She's an independent healthcare consultant with over 25 years of experience in the industry. Her area of specialty includes healthcare regulations with a focus on security and privacy. She actively participates as a work group for Electronic Data Interchange Strategic National Implementation Process, we SNP. She's co-chair as the Security and Privacy work group as well. She's a content contributor and creator of HIPAA privacy and security policy and procedure templates. She has a number of different certifications. She's a security and privacy content contributor as well and serves as a board member for PREVA Plan. Ron Moser is a consultant and the site reviewer senior auditor for EHNAC. He provides leadership in the development of new programs and has detailed knowledge of each of our programs. He performs audits for EHNAC and provides leadership and training for our site reviewers auditors. He is also managing director of Moser House Consulting, which provides guidance to healthcare IT organizations that want to improve their operations through the implementation of effective risk-based IT controls. He maintains his CISA and CRISC certifications and has a BS degree in computer science from Taylor University. So I want to thank both Leslie and Ron as well for participating on the webinar. So what we're going to try to go over with you today is give you kind of a background on EHNAC and OCR audits, can give you some perspective on where OCR started back in 2012, where they are today, where they're going. Then Ron is going to go into a review of some of the specific criteria changes that we're looking at, and he'll be going through kind of some of the issues and what we're doing as far as timeline, and giving all of you an opportunity to provide feedback to those over the next couple of months. Leslie is going to go into some of the samples of criteria changes in security, breach, and privacy. And she'll be giving a lot more detail on our specific thought process there, as well as what OCR is doing. And then we'll get into next steps and a Q&A process in which we want and invite your participation and questions. And so what I'm going to tell you is, as we're going along, if you have questions, please type in the questions and we will get to them at the end of the actual presentation. And go right into the QA process and get your questions answered as much as possible. And again, we do appreciate your participation on the webinar, and please, let's get all your questions answered as you're looking at this part of your risk mitigation strategies and how you're going to deal with an OCR audit should you be selected for one. Next slide, David. So let me provide start with some context here on OCR, where they've been. So again, I think many of you know back in 2012 they started this entire process of doing audits, and they focused really on at that time on the covered entities. The focus certainly was on HIPAA and high-tech and PHI, and basically as part of the process and as part of the high-tech provisions, legislative provisions, it required periodic audits of covered entities and businesses. And so what they were looking at is about 115 different covered entities or CEs as part of this first phase of the audit process for compliance. Next slide, David. One of the things I was going to also share with you that came out of the 2012 audits was a number of findings that they came up with. One, as far as the privacy rule, as they went through this, they identified that about 44% had issues with uses and disclosures of PHI with problems. The next highest one was notice of privacy practices, in which people had issues with being able to, they weren't available, they weren't appropriate, they weren't complete. So about 20% had an issue with notice of privacy practices. If you look at some of the security rule findings, again from the 2012, the highest issue where they found problems was in contingency planning, where organizations, although they may have had a plan, didn't have a business continuity or contingency plan in the event that they had a breach or an incident, and it could cause significant implications to loss of business and business processes and being able to conduct business. And so the whole contingency planning was a major issue that they identified. The next, there were several others right after that that were at 14%, and that was access management, audit controls and monitoring, lack of necessary audit controls and monitoring, and movement and destruction of media. So those, all three of those were at 14% as part of what they identified as issues. And so if you look at, some additional findings that came out of that, is that one of the, as far as causes of large breaches, the biggest one that they found was really theft, and that was at about 47%. The next highest was really unauthorized access and disclosure of information at 16%, and then you had loss at 11%. Hacking and IT incident back then was about 6%, and improper disposal of media was 5%. And then you look at the source of large breaches that they came up with, and is really the number one was laptops at 29%, paper at 20%, and then emails at 10%, and other at 19%. So there's some very good information that came out of it. Now, as we all know, a lot of the demographics here have changed, and we're seeing a far greater percentage of now cyber and ransomware attacks. The numbers of breaches, incidents are increasing, and the fines that OCR are levying now are much greater than even back in 2012, which brings us to kind of current day in 2016. And so they became, so as many of you know, 2 years ago, the omnibus rule was, and with the omnibus rule, that now increased the overall visibility and compliance to now business associates, along with covered entities, and both having no difference in relation to what is necessary as far as to achieve compliance. So they've now started in 2016 their Phase II audits. They're looking at obviously the policies, the procedures. They're looking at a variety of standards and implementation specifications, all again related to the privacy, security, and breach notification rules. In July, there were about 167 covered entities were contacted to provide some documented responses to some pre-audit questionnaires. And we are expecting that business associates, they'll be selecting a similar number of business associates that they'll be sending notices out to as well. They're looking at about 200 to 250 audits in this particular phase. And they're thinking, although the majority of these right now are desk audits, they're expecting that they will be doing in 2017 some additional on-site audits, and depending upon what they identify when they go through a desk audit, if they determine that there's a particular area of significant risk, they may as well identify the organization that they need to do a follow-on on-site audit as well. And just as an aside, if OCR receives complaints from organizations regarding specific issues that are brought to their attention, in most cases they will as well do on-site audits to follow up on a complaint. Next slide, David. So as we continue to look here, and I talked to you about the fact that this is going to be both covered entities and business associates. The focus on who's included under the covered entity includes health plans, clearinghouses, individual and provider organizations, and business associates is really any business associate, any vendor, any entity that's providing services as a business associate to an organization is also included. Next slide, David. The thoughts that we have for you as you're going through and determining how do we prepare for an audit in the event that we are selected. This provides kind of a context for you to look at. I won't go through it, but the thought is really planning how you're going to respond, preparing for it, having the appropriate documentation, facilitating across the organization with various entities and people and teams that are doing and putting together the appropriate components and how you're going to respond. So, and again, what you're going to be hearing from both Leslie and Ron is certainly having gone through, all of you are either candidates or accredited organizations for EHNAC, you've got a really great set of documentation already to be able to respond to an audit. And both Leslie and Ron will be talking about what we're including and how we're looking to help you prepare for all that. Next slide, David. So again, a lot of people are asking us, what's the risk if we are selected for an audit? Well, if you look at the objectives, it's really to looking at the mechanisms for compliance, what types of best practices organizations are using, identification of risks and vulnerabilities, as well as looking at all of the attention that organizations are putting in and the emphasis on their privacy and security and compliance activities and practices. So what we're trying to do, again, and the risk is, again, you've seen the numbers. We've had several of our organizations in 2012 were selected to go through an audit and did go through the audit with OCR and provided their documentation, their EHNAC, and they provided their EHNAC accreditation packages in response to those audits, and all did very well. So it is our intent as an accreditation organization to really assist you and hopefully help you to prepare in the event that you are selected for an audit. And hopefully as we go through this, you'll see that, in fact, you've got a great set of documentation and process, structure, policies, procedures, and controls in place to be able to respond to it. Next slide. I'll turn this over to you, Ron.
Okay, thank you, Lee. And again, thank you to each one who are participating today. Hopefully you'll find this very informative. I'm going to just kind of lay out the groundwork, and then Leslie's going to take us into the details. And I do want to really highlight the fact that Leslie has done a lot of the really hard work in going through all of these changes, and she'll do an excellent job in helping you to understand what they are. But first, as kind of a framework, as Lee mentioned, with the advent of the OCR audits back in 2012, EHNAC at that time was able to actually sit down with OCR and talk through what their audits involved, and we really worked to make sure that we made the appropriate revisions to our criteria, to our specific requirements, to help organizations accredited by EHNAC to be prepared for an OCR audit. And we're going through that again with the release of the Phase II information, or as OCR calls it, their Phase II protocol. Again, Leslie has poured through that, and we've had that reviewed by multiple people, the work she's done, and our goal is to enhance our criteria so that we have the right things in place to conform with even the changes they have with the Phase II. Now, some of you may be aware of this. In January, the new release of the criteria, and each year EHNAC does at least one release of all of their criteria. So every program will have a new release in January, And what we're doing this time around is we're really going to provide parity across our programs for HIPAA-related criteria. So you'll find the same requirements across HIPAA privacy, security, and breach requirements in every one of our programs, with a slight exception on the cloud accreditation or cloud-enabled accreditation program. I won't go into that right now. Anyone who is using a cloud service provider or is considering using one certainly can contact us for specifics on that. But all of the 17 other programs have, or as of January, will have common criteria when it comes to HIPAA privacy, security, and breach reporting for those areas. And so we are updating all of the programs not only in terms of parity on those, but in enhancing them based on the OCR Phase II requirements. I also wanted to discuss the fact that how these changes are made. Some of you, probably several of you on this call, are part of the EHNAC Criteria Committee. Those of you who aren't, I would encourage your involvement, and you can contact EHNAC operations, or you can email me or anyone on this call if you'd like to join the EHNAC Criteria Committee. We expect participation, we expect involvement, but it does allow you to look at criteria early on, to look at recommendations, to provide feedback and your own recommendations so that you can see the whole process and contribute to the changes as we put them into place. So all of these changes that we're working on are being submitted to or have been submitted to the Criteria Committee, and we're going to be reviewing them in this month's Criteria Committee call. Once the revisions are approved, they will go out for 60-day public comment. So during the 60-day public comment, you yourselves and all of the public, everybody, can look at the criteria and can provide feedback and recommendations, input on what you see. So be looking for that announcement for the public review period if you're not on the Criteria Committee, and that'll give you an opportunity to provide any feedback on these as well. So getting to this slide here, I've pretty much covered this, I guess, but EHNAC has been working very hard at getting all of our programs in parity with respect to our core criteria, particularly our HIPAA privacy, security, and breach reporting, and including the OCR Phase II protocol updates. We, as I mentioned, will be releasing this new criteria in January 2017. So all of the things Leslie will be discussing are things that we are building in terms of enhancements to our criteria. And with that, Leslie, you can correct me on anything I've stated, but I will turn it over to you. Thank you.
Thank you, Ron. And just before I start speaking, am I coming across clearly?
Absolutely. Hear you loud and clear.
Okay, thank you. Good day to everyone. Just a very quick clarification and also a good introduction to our slide here on the examples of specific changes. When Lee had introduced me, I am no longer a WEDI SNP national co-chair, but I did hold that position for a period of 10 years. And while doing that, had the opportunity to work with the industry on really focusing on the regulations, literally as they were promulgated and then released into the industry, and how the privacy, security, high-tech breach, et cetera, all applies to different kinds of entities. So from that perspective, it was a wonderful opportunity to get to look as well with Ron and others across EHNAC on the criteria in general and building towards that parity. As you see in this slide, we really focused on 3 different areas. Of course, obviously the core HIPAA, privacy, security, and high-tech breach areas. And I'd just like to kind of hover for a minute on each of those as a topic area. With respect to security, EHNAC, of course, because of its history and strength across security-related items, not just HIPAA, but across industry standards and ISO standards, et cetera, really had a great strength in the area of security. It was strong across all 3 of these, but the security piece was absolutely the piece that, in my mind, has probably the least amount of changes. Where the changes are coming in, though, are on specific acceptable evidence components that are now going to be required or are now more specific. One of the things we're going to suggest that you do is spend some time looking directly at the Office for Civil Rights Audit protocols. Obviously, it's quite a lengthy document to go through online, but it does give you lots and lots of examples. And so in the area of security, I'm going to pull an example in our normal, one of our core programs, the Administrative Safeguards section, where we talk about how it's a general requirement that a candidate must implement policies and procedures to establish, document, review, and modify a user's right of access to a workstation, a transaction, a program, or a process. This is a great area where typically there are requested examples of acceptable evidence. And one of the things that I know as reviewers we all try to do consistently as we work with all of you is we talk about these lists of acceptable evidence examples. And what I'll normally say is if something's required, we must see it. And typically you have maybe 3 or 4 different examples of acceptable evidence pre all of this work that has occurred. Sometimes things are required, as I mentioned, but oftentimes going into specifics is very much can be based on the individual reviewer, the entity, what you provide, etc. For this particular criterion regarding the access establishment, our previous acceptable evidence list included access authorization policies and procedures, a system access request form, and description of a system access approval workflow. All items that we may want to go through in detail as a reviewer as I'm looking at your submission package and materials and going through the on-site interview. One of the things that the Office for Civil Rights Audit protocol has now added to this very criteria and cross-referenced across to the HIPAA security rule implementation specification is that they want documentation demonstrating that individual access to information systems, both for a new workforce member and one that has been modified based on access authorization policies, is provided, and this is now required. So in general, with respect to the area of security, not a lot of changes, but what you will see are new specifics regarding acceptable evidence. And then as reviewers, we have some additional guidelines to make sure, particularly if it's something that OCR is specifically looking for, that we of course also make sure to request to see that and work through the validation of that when we work with you. I'll just pause there for a moment. If there's Ron or Lee, would you like to add anything to that before I go to breach?
I don't think so, other than possible clarification, and that is just it's just reiterating what you said. In the past, some areas where it may have been, here's some sample evidence you can provide. Now some of it's going to be required, as Leslie was saying. So there will be some things where it's not just an option as a possibility, but you must have this. And the way we show that is on the sample of acceptable evidence. To the right side of it, it will say in parentheses, required. And there will be new samples of acceptable evidence listed on some of these that have requirements. So thanks, Leslie.
Thanks, Ron. Thank you.
That was a good overview, Leslie, and Ron, I think good clarification there. I guess you can go on, Leslie.
Okay, with respect to the area of breach, I really believe the changes with respect to the area of breach are from 2 different kinds of factors. One, of course, is the same as security, just looking to match up those areas where OCR says we are looking for this specifically to make sure that our acceptable evidence also is requiring the same thing. The second is the fact that I think breach has very much matured. Literally in the last 5 or 6 years, we've been able to see many more examples of how the rule is applied and see how others are handled it, both through the corrective action programs and the publishing of the information through OCR. So one of the key changes to breach is that we have always, as reviewers, asked to see if you had a breach. We would ask to see how you handled that. I'm looking for you to have consistent activity and behavior according to what your policies and procedures and documents, et cetera, show. One of the changes now, in addition, is that if you should experience a breach or you're working through a potential privacy security incident following your breach protocols, and you need to report that. Of course, if it's over 500, the guidelines are different if it's affecting 500 individuals at the same time. We'll also be looking for you, should you have, we call them the onesie twosies potential issues, where you may have you've confirmed something occurred, it may have only affected a few people. You still need to report that to the Secretary within a period of time after the close of every calendar year. That's a great example of a new acceptable evidence that's more specific, where we're also looking for that particular breach log. I think that very much closes breach. We don't have as many criteria, just in sheer numbers, that are affected by the breach area. And now I'll transition into privacy, and I think this is really where the majority of the changes have occurred, but not because we didn't already have a nice mix of the privacy types of requirements already in the criterion across the core programs, but more so because we've taken it a step further, picking up from Lee's comment about the 2012 audit results and how one of the highest % of findings is that for privacy uses and disclosures were not necessarily done in alignment with the regulations. And so thinking through the area of privacy, you really have to stop and consider one of our current core criteria regards confidentiality and privacy and how you handle protected health information. It's all about that PHI and how you're handling it and how it applies to your organization specifically. So in thinking about privacy, the criteria have changed in that we're now using enhanced tools, diagrams, we're leveraging some of the kinds of things that OCR and their audit protocol have suggested, and really trying to help drive further where you as a candidate organization or accredited organization has documented very clearly how your lines of business, if you will, handle protected health information. And that is exactly in alignment with the way the Office for Civil Rights does it, looking for when you deem that to be according to a designated record set, which is a privacy term, of course, looking for whether you receive that data from someone else, whether you're a covered entity or a business associate, if you create it yourself, if you maintain it, if you transmit it, and having all those kinds of controls around it based on how you're handling it, how it moves, how your controls are set up. So probably the first thing to think about when you think about privacy, because it's so huge and so complex, is to try to break it into categories. Seems to be one of the most helpful ways to just think about it. And so in applying the regulations against all of the EHNAC criteria, what we did was we broke it into the 4 buckets, if you will, you see at the bottom of the slide. We started, of course, with administrative requirements, went into uses and disclosures, all of the individual rights, and then general safeguards. Now I'm going to work on this list from the bottom up. And if you were all part of HIPAA, privacy and security, you might remember that the privacy rule was released first to the public, and it included this general safeguard section. And then when the security rule was released, it very much took that general safeguards 530C section and expanded it into the security rule. So we've really very much already addressed in general that all of the previous EHNAC criterion just in itself was very, very strong with respect to security. So you're not going to see many changes with respect to general safeguards. As we come up the bottom bullets of this list and think about individual rights and uses and disclosures, those are the 2 key areas that once you peel back the layers of the privacy rule and you determine that you are handling that level of protected health information, then you have many more things to do. And I just wanted to add a waiver right here, is that one of the things I think that is just so unique about the way we do reviews with EHNAC for organizations is that we don't tell you how the rules apply to you. It's your business and your jobs to have your compliance and legal people help you do that. But we do ask you to prove where you have done the due diligence to consider how the rules apply to you. And so based on the level of PHI you handle, you may have more work to do in the area of policies and procedures and demonstrating which policies and procedures you need when it relates to uses and disclosures and individual rights. I'm just going to hover for one more minute on administrative requirements, and then I'll pause. With respect to administrative requirements, the work to compare to the core criteria within EHNAC also was very strong. For years, even when it was not clear across the HIPAA regulations, EHNAC has requested that there be a privacy and security officer appointed, that there are strong training controls, that you can prove you keep your policies and procedures updated. All of those fall into the administrative requirements category. So there certainly were some minor changes as we created that parity between the regulations and the EHNAC criterion, but for sure the focus is on the level of PHI, uses and disclosures, and individual rights. So I'm going to pause now because I covered a lot, and this is where it gets really complex.
All right, and if I may, Leslie, can I throw something in quick?
Please.
Okay, one of the things you'll see directly related to this that kind of sets the stage is in the very first criterion, and this is based on what we are recommending to the criteria committee. Instead of just showing a data flow, who it is you connect with, one of the other things we're requiring is something we're referring to as a PHI data level survey. And that takes you through a series of questions to help you identify exactly where you're at in terms of privacy requirements, because depending on what sort of things you do with PHI and who you come into contact with has a bearing on how and which ones of these privacy requirements apply. And I'll give one real quick example. I know Leslie can do better than this, and that is just, do you ever have direct support with patients? If a patient calls your customer support, do you try to answer their question? Do you try to provide them with information, or do you always, by policy, direct them back to their healthcare provider or payer? So that's one example of that. But I just wanted to let you know right from the start in the programs you will see, and what we're planning on, again, I can't say definite until the criteria committee and the commission approve this, but we believe you'll see as a very first criteria a requirement that you go through some questions and answers and determine exactly how you handle PHI.
And that's a great segue.
Ron and Leslie, can I just also interject that, again, as Leslie and Ron are going through a lot of good information here, if you do have questions, please type in your questions so that we can get to them when we get to the Q&A section. But great overview, Leslie.
Thanks. It's a good segue into our next slide, please, David. So now we're going to focus in on this level of PHI handled. And remember, it's all based on the Office of Civil Rights. When the breach requirements first came out and the Office for Civil Rights set up their website and said, if you have to log, here's what you want to log. Tell us about the kind of PHI that you have, whether it's financial or demographic or clinical, and also whether you create it, receive it, maintain it, or transmit it. So we've kind of built this survey that Ron's talking about, which this slide is directly referring to, all on the OCR requirements, so we can stay very consistent with the way they break things apart as well. The first one is a little bit confusing in that it says PHI is not ever directly accessed by any workforce member. Be very careful with this one. Certainly you are going through all of this work and you are an EHNAC accredited organization or a candidate because you're handling sensitive data. So this does not mean that you don't ever have data or that you don't have any other work to do. The next sentence in italics says, when selected, no further action or completion of criteria is required. To be very, very clear, you still, if this was your scenario, would still need to complete all of the criteria across the program for which you are seeking accreditation. It means that you may not have to go further as it relates to uses and disclosures and individual rights specific to privacy. Probably talking about some samples of types of organizations that might fall into this first bucket, if you will. A data center, perhaps, that is a tertiary or a third kind of backup site, if you would, that perhaps already only handles encrypted data, never has access to the keys. So in other words, it's highly unlikely that anyone is going to actually be able to access that PHI. Another example, sometimes those doing secure messaging will say that the only time truly PHI is not encrypted is during that millisecond that the actual message is, the envelope is opened and the determination of where that message needs to go occurs. And that would be another great example. These are organizations that, other than those very, very brief examples of how PHI is moved or handled, and usually when it's encrypted, might be able to say, we don't ever allow access. Now that would be according to your policies, procedures, and controls. Now the point here is if there's ever a potential that somebody could do something in a negative manner to that data that you're responsible for, of course, that would kind of be a way to summarize this particular scenario. I'm going to go ahead to the next two and then open for comments. So the idea here is there's really not a lot of PHI that is being handled by multiple workforce members in this particular scenario. The second scenario would be where PHI, protected health information, is sometimes accessible to workforce members. And that would be, again, in a normal work environment. A great example might be if you are a software vendor and you provide remote support. So you have workforce members supporting customers, logging in or directly being able to see PHI. Even though that's not really the job you're carrying out, you're really trying to help them fix whatever might be wrong with the application, for example. But if you may be exposed to PHI while you're doing it, you might fall into this category. Now when this applies, this is this middle-of-the-road approach. We don't believe that you're a covered entity, and of course, again, that's your determination whether you're a covered entity or business associate and how the rules apply to you. But we know that you need to demonstrate that you have considered this additional layer of health information that you handle, and you've made sure that all of the specifics laid out in the privacy rule relating to uses and disclosures and individual rights, that you have determined how you're going to handle those scenarios. So Ron just threw out a great example, and he's actually talking probably about the third category. But if you're a business associate, let's say you're a billing company and you have a call center or customer service area where you may directly speak with a member or patient of the provider or the health plan, whoever your customer is that you're servicing. The point is, in the course of that discussion, if you are gaining protected health information, you absolutely need to look at your uses and disclosures and individual rights. And it may be, as Ron said, that your workforce members are told to say, when this question comes up, you refer them back to the provider. That may be the way you handle it, but from an EHNAC perspective as reviewers, we want to know that you've done your due diligence, you've looked at this layer of uses and disclosures and individual rights, you've documented what your stance is going to be, and you've provided policies and procedures if deemed applicable. Now I want to go back one more time to the third, because if you are a covered entity, you should always have gone through this exercise of uses and disclosures and individual rights based on the level of data you handle to decide which ones apply to you. Now I've thrown a lot out here right now. I think and we have one typo we'll have to fix in this slide on the bottom. The individual rights must have been addressed. But definitely this is probably a good spot for questions, if there are any, regarding the level of PHI accessed.
And again, any questions you all might have, since we can't hear you right now, you can type those in and we'll get to those at the end. But again, Leslie, I think this is an excellent summary of, again, evaluating in what situations, based on the services you provide, whether or not and to what degree you're responsible for providing uses and disclosures and individual rights, notices and such. And again, I'll reemphasize, one thing I think is worth emphasizing is there's a difference also between being EHNAC accredited and demonstrating compliance with HIPAA, because for starts, EHNAC obviously has requirements that go beyond HIPAA in general when they get to some of the stakeholder-specific requirements, whether you're an ACO or a HISP or a EPCS provider or whatever. But even within some of the HIPAA-related requirements, we might push further than some other organizations would be, because we want to make sure that you're sufficiently protecting your data, and we value when you have the EHNAC accreditation, what that means in terms of an organization. So sometimes we will press people a little further than they think they need to be pressed, but it is EHNAC accreditation that our candidates are going after. But this slide really clarifies the fact that from a privacy perspective, it helps you to understand when you need to specifically have uses and disclosures, individual rights, and some of the privacy-related requirements of HIPAA, because even if you don't need some of those, again, if PHI should never be directly accessed by a workforce member, EHNAC, through its security requirements, will still press you in terms of, if you don't have the proper controls in place, or if somebody violates your policies, who is it in your organization who could potentially do that? And we get into, training and termination requirements and things like that to address those. So probably talk too much, but just thought I'd provide those comments, Leslie.
I think that's a very good clarification, Ron and Leslie. David, do we have any questions right now that that you have that we could address having to do with what we've got at this point?
We have one question from your presentation, Lee. Someone was asking, where can we find the statistics being cited? And I think she was looking, or he was looking for the statistics that you were citing early in your overview of the status. Perfect.
So what I'll do is we'll make, first of all, at the end of the presentation, we're going to make the presentation. We're going to give you information on how to get the presentation for, again, all of our accredited organizations and candidates. We'll include in that the information that I provided and some of the statistics that I went over. As far as that'll be in there as well.
Okay, thank you. So before we leave this slide, I have two other key points I'd like to really reinforce. What you'll see in the criterion is now that we have added two new categories under the confidentiality privacy section. One is entitled Individual Rights, PHI Individual Rights, and one is entitled PHI Uses and Disclosures. So when, as an organization, you're going through your accreditation or reaccreditation, and you're completing the PHI flow and the PHI level survey, should you deem that your situation is number 2 or number 3 that we just reviewed on this slide, you're going to also want to go over to the new criteria and look at the new PHI individual rights or uses and disclosures. Now, thinking just about individual rights for a moment, and just to recap and refresh everybody from our HIPAA privacy days, we're talking, of course, about that notice of privacy practices that Lee was talking about, that many entities did not handle well. Now, as a business associate, you might distribute the notice of privacy practices on behalf of a covered entity. As a covered entity, it's time to go back to those requirements and make sure you have the respective required language and you're producing those documents according to the rules. You've got all of your rights, your right to access, your right to amend, your right to alternative communication, and accounting for disclosures and requesting restriction and complaints. And all of those, again, may be something that your organization does, and you handle those directly. If you work directly with PHI, especially with a designated record set, and it may simply be something that you say, we never do this, we're never responsible for the notice of privacy practices, we're a business associate, we don't need to handle this. What we're encouraging you to do is to prove you've gone through this process, made those business decisions, and that you could pull that out and say, here, this is why we've deemed this not applying to us, or this is why we have a new policy and procedure. So that's on individual rights. On uses and disclosures, you have to remember, we're not necessarily telling you that the rule applies to you, but it could be that the situation applies to you and the way you handle your data, and therefore you might want to borrow, if you will, from some of these requirements. So thinking about uses and disclosures, there are many uses and disclosures for purposes of research, for providing information of deceased individuals, for marketing purposes and fundraising and things that may not ever apply to you. However, one that does seem to apply more and more these days, even to business associates for consideration. If you handle PHI and you're responsible to take care of it, so to speak, and you have outside entities asking for you to provide that to you, and they may even offer to sell it, to buy it from you, or to just take it for very credible purposes like research or oversight activities. And they'll say, you can aggregate it. You don't need to give us PHI, but here, just aggregate it. From a reviewer's perspective, that's a red flag to say, I'm looking for a policy and procedure regarding de-identifying information according to the privacy rule. So again, I'm taking almost a slippery slope approach here to explain how some of these very detailed areas and uses and disclosures may apply to you. So again, we're setting forth everything contained in the regulation, looking for you to have done your due diligence to prove back to us that you have considered if it applies. If it applies, we'll be looking for policies and procedures, and then of course that you follow those protocols. I think that's about the end of this slide. Dave, if you'd like to go to the next one. Thank you. I think, yes.
If I can say just real quick, there's some background noise. I don't know if there might be some wind or a fan where you are. I've been trying to unmute some others. I just thought I'd give everybody a heads up that there's a little bit of background noise.
Yes, and I do not think it's my office, but thanks.
Thank you very much.
You're welcome. With respect to the immediate checkpoints, the question is, what do I do now? We've got 8 that we provided out to everyone, and just in the interest of rounding it out to be 10, I'm going to add 2 more that are probably already implied. But spend some time going through the website and take a look at the kinds of issues that others have faced. If you know that your area is not strong in the area of breach handling, for example, spend time looking at the corrective action plans and the breach reporting. We've never had such good information available to us on the internet. The OCR websites and the related links, etc., are very, very good, very complete now. If you are asked to complete one of these audits, there is a short form, if you will, that has to be filled out very quickly. So it makes a lot of sense to go look at that right now. Make sure that you know how your entity would respond if it is yours. Just do some homework in advance. The second thing that I'm adding willy-nilly to make this 10 instead of 8, and that probably is applied, but I've seen in preparing for this, give them what they ask for. And this goes as well as being a reviewer. If we are specifically asking for proof of something, a log that training occurred that is within the last year. Provide just what we're looking for. It helps the review process, whether it's just us within EHNAC or it's OCR, and I have my regulator hat on. Give them what they ask for. Don't give them a lot more, so they have to go looking for things, and make sure to give them just what they're looking for. So that's kind of, those are the number 1 and 2 that are implied here. So going back to the top 8 on the slide, number 1, make sure your policies and procedures that you are living by them. This is a living, breathing, ongoing thing. You need to make sure that the way your workforce behaves is both the way you've documented it in your policies and procedures and the way that it's actually happening in real life. You do not want to be in a position where you have a beautiful big policy and procedure document, but it's never been pulled off the shelf, and it's dusty and has no dates of revision. You want to make sure that acceptable evidence can be provided that proves your policies and procedures are the way you want your workforce to behave. Number 1. Number 2. Don't forget, the HIPAA security rule immediately required the security risk analysis, and then there's ongoing risk management. And so it's not good enough to say, oh, when HIPAA came along in 2006 for security, we went ahead and did our risk analysis, and here it is. You want to demonstrate that you live and breathe by a routine, ongoing risk analysis. And if something has occurred in your organization, then that should probably get added as another thing that potentially could occur. And you want to make sure that you don't repeat that behavior. And so adding to your risk analysis, whether you augment it by looking at NIST or other industry recommended standards, etc., make sure that that, again, is a living and breathing process that your organization holds highly, regards, and uses. We will look for you to not only document thoroughly, we'll look for you to show that you're considering the way PHI is handled when you do your risk analysis. And we'll be looking as well, even though this is HIPAA security and these rules were promulgated separately, EHNAC takes the whole enchilada, if you will, and we're looking as well for paper PHI and how that's handled. So we'll really kind of push back and expand that your risk analysis is holistic. And then the part of the management piece means that you're living by it. Means that you're doing it regularly, and when you find issues, you can demonstrate in a documented form that you're doing your mitigation and that you're making sure to prevent whatever that scenario was from happening again. So again, you really can use in tandem your PHI flow document that's in your submission package should just work right alongside your risk analysis. This is probably a great spot to halt and see if Ron or Lee would like to add anything. If we go ahead to the next slide, please, David.
I don't have anything at this point, Lee.
No, I don't either, Leslie. Very good.
Okay. So again, this one I think we're really driving home today, making sure that the level of compliance of these regulations are directly in alignment with the level of protected health information that your organization is handling. And again, it really drives to, it doesn't matter anymore if you're a covered entity or a business associate, if you are taking in protected health information and you are adding to PHI in a designated record set, you need to make sure that any of those individual rights are documented, how your workforce is supposed to behave. And again, making sure this is across the board, whether it's electronic or hard copy or even spoken, according to the privacy rule, that your PHI flow and the way you handle that data, create it, receive it, maintain it, transmit it. And don't forget, it may be that your entity only ever receives and maintains, or receives and maintains and transmits. It doesn't mean that you do all of those, but it means that you know how you do that. And one last thing, don't forget as well, you may have multiple, I'm going to call them lines of business within your organization. Let's say that you're a secure message provider, you participate with our DTAP program as a HISP, but you also are a health information exchange, for example, organization. Well, your data is probably going to be handled. You're probably going to create, receive, maintain, transmit differently across your lines of business. To the degree that you can succinctly and clearly demonstrate that right up front with your diagrams and flowcharts, that helps whomever your reviewer is, to see how data and how requirements are applied across your entity. Don't forget with your training, all of your workforce members need to be trained. That's anyone under your direct control. So that might be the CFO's daughter who comes in and helps file data or file something on the weekends. It does not necessarily mean that it's a full-time employee or a contractor. You're talking about anybody who should be taking control from you, direct control, and basically having access to PHI. They should be proved that they are being trained on a routine basis. Don't forget, you want to train before they have access to PHI, and then as necessary on an ongoing basis. And don't forget as well, I mentioned Office for Civil Rights. There are wonderful training programs also, and games to play to understand how data moves for your smaller kinds of entities on both the National Coordinator and the OCR websites. So any of those places that can strengthen your training, make sure to provide those back and prove that you're using ongoing curriculum. Go to the next slide, please. Don't forget to hold your workforce members accountable. You can see this circles right back around to the first one. Have policies and procedures that teach your workforce how to behave. Make sure then that that is how they're behaving. And so if you have to change their behavior patterns by correcting them through use of sanctions, etc., make sure that you're doing that you're obviously following your protocols and you're documenting well, and you can prove that you're holding workforce members accountable. Number 6, be ready for any breach issues. Obviously this one is very tough, and unfortunately we see what happens almost every day in the news of some sort of breach, so be ready. Don't wait until you have a problem to figure out who in the organization is going to speak to the news media and what it is they're going to say. Having your checklists and forms and proof of ongoing logs and records. We would much rather see that you had a potential issue, you didn't think it was really a big deal, but you walked it through the protocol anyway, and to show that to us. That's a wonderful way to demonstrate you're ready should you also receive an OCR audit. Go ahead to the next slide, please. Business associate agreements. Oh, I'm so glad this one came up where it did. When I mentioned number 1 that was being implied to go out and look at the website, when you look at what the OCR desk audits are asking for, that kind of little cheat sheet survey they ask you to fill out, they also ask you, at least for the covered entities, to provide your current list of business associate agreements or business associates that you can identify those who handle PHI on your behalf. Whether or not they're going to ask the business associates for their downstream BAs, I'm not sure if we know that yet, but it doesn't really matter, because whether you're a covered entity or a business associate, if you provide PHI to somebody else to help you do your business, obviously you want to make sure you've got your various BA agreements in place, that they're up to date with the high-tech language, and that you very quickly and easily can contact them. Number 8, should you be utilizing cloud services, make sure that your PHI flow and all of your policies and procedures, both your technical and non-technical controls, those policies versus the technical controls, that everything is up to date and circling around the fact that if your PHI is being somehow handled, whether it's created, received, maintained, or transmitted via cloud services, that this is specifically set forth. Ron, that's probably a great spot. I know you mentioned before that we've been releasing further enhancements to the cloud services, so probably an area for people to watch for additional in 2017?
Yes, that's right. And we do have, for those of you who are considering or who already do use a third-party cloud service provider, specifically for your production systems or for systems through which you communicate PHI. EHNAC, a couple years ago, we did not support that, but we do support it now through the completion of a program called our Cloud-Enabled Accreditation Program. So if you're using a third-party cloud versus a traditional data center, we now have a program to support that, and we'd be happy to provide more information on that if you'd like. But in terms of privacy and the whole OCR protocol, I think you've covered it very well, Leslie. Thank you.
You're
Leslie,
welcome.
Lee, I just wanted to make one other comment. You know, in the points that you were making on holding workforce members accountable, which is a very important one as well. I think a couple things just to further emphasize. One is, you know, consistency on for organizations and for management on how they're looking to hold the workforce accountable, and the types of procedures, the oversight, et cetera, needs to be consistent across all employees. That's one. I think the other is that we've seen a lot of organizations using a combination of signs that they might put up on how to deal with privacy, just keeping the focus and people's attention so that they're thinking about privacy, et cetera, as well as we see a number of organizations as well providing different types of notifications, either by pushing out notifications to staff about different pointers that they might have, or hints on what people should be keeping aware of. It's just, again, I think other types of ways in which organizations can keep the workforce aware and diligent regarding how they're handling PHI.
Mm-hmm. Thank you. I think actually this is the end of my slides, so I think we move to our Q&A section now.
All right, great. Leslie, thank you very much, and Ron as well. So David, do we have any questions queued up?
Yes, we have a statement and a question at the end. The Consumer Financial Protection Bureau, CFPB, will likely reach into first-party accounts receivable in healthcare in 2017, which will force covered entities, hospitals, to construct a thorough compliance management system that includes policy, procedure, and work instructions. Has EHNAC, the question is, has EHNAC considered how to incorporate HHS/OCR compliance into an overall compliance management system? I think CEs are going to be overwhelmed considering their inability to even fully comply with 501R.
Leslie or Ron, any thoughts on that one?
I'll jump in first and just say I'm not very familiar with that. I don't know if that would primarily be in the domain of healthcare providers, which today EHNAC doesn't really have programs that address healthcare providers, but if it's covered entities in general, then it could be related to healthcare payers or clearinghouses that are defined both to be covered entities. We would certainly appreciate more information. Scott, if you could provide that so we can look into that. Leslie, I don't know if you have any more information on that.
Not really information, but I zoned right in on the overwhelmed comment. I get to hear that a lot, and I think that it's really hard on organizations these days, especially with all the stepped up concern over breach, and for a long time, or entities were told you really don't need to do too much care, if you will, about your business associates and how they're doing business, and it seems like now there's much more of a responsibility on everybody else that you utilize, all third parties, whether you're talking covered entities or BAs, et cetera. So we hear so many times that people have to go through a number of different kinds of audits and different things. So I think in general we hear you, and to the degree that the program is very, includes a lot of core components across privacy, security, and breach, I think it can apply, but certainly I don't have any details on this particular one.
Thanks, and I think, Ron, as you indicated, if whoever submitted the question, if you can provide some additional information to us, we'll be happy to do a little research on it. So that would be terrific. David, any other questions?
I think Scott replied, will do. Another question, vendor business associate agreements should be utilized as well for BA service providers that do or may come in contact with PHI, IIHI that the BA handles. I guess that's a statement.
And I can touch on that quickly. I'd read that. I'm thinking, I might be wrong, but I'm thinking that's referring to basically when a BA in turn has another BA that it shares information with. Sometimes that's referred to as a subcontractor, or basically it's just another BA, because there can be many down the chain. I think Omnibus started referring to them as subcontractors as well. But yes, indeed, I'm trying to get back to what the actual question was. But yes, we do expect those to be in place down the line. And one of the specific provisions we look for in a BA agreement is a subcontractor clause that requires the BA to enforce all the same requirements of the BA agreement with any subcontractors they have. So that kind of makes it go all the way down the line. I don't know if you have any other interpretations of this, Leslie or Lee.
Not interpretations from my perspective, but two more things to add just to confirm. So earlier in the discussion, and I think when Lee was presenting, we saw that OCR first went out to covered entities, and one of the requirements in the initial audit is to ask for all of their downstream business associates. And so when I was finishing up this last section of the slides, I reinforced, don't forget, have your business associates under contract. So I am also referring to that downstream use. So even if you are a vendor business associate, if you have a third party or a subcontractor that handles PHI that you're responsible for to help you carry out your function, that would obviously be a business associate agreement, one that Ron was just talking about. We would also be looking for you to have those current and up to date and be able to have them in one place so you could quickly get to all of your BAs. And just one more thing that we see, when HITECH came through and the Office for Civil Rights a little bit later provided some more detailed information on completing business associate agreements, and some of the samples they provided included a sample that actually talks about what PHI is being handled and the purpose for which it is being handled by that downstream business associate. And that tends to be a really great way to tie everything together, your PHI flow, whether you create, receive, maintain, transmit. When you downstream that to a third-party business associate, if you incorporate that in your business associate agreement, it's very helpful to demonstrate the purpose for which that PHI is being handled.
Thanks. I'll give one other real quick example because I thought it was a great example. I'm sure there'd be many others, but there was I believe it was a hospital maybe in North Carolina not too long ago that, just as an example for why it's so important to scrutinize your vendors, this one may have seemed obvious, but you've got to know which vendors are BAs and make sure you have an agreement in place. There was a hospital that was sending x-rays to a third party to have them digitized. They basically would pay them, I think, via whatever silver they got off the x-rays. That was their payment. Sounded like a neat service, but they didn't have a BA agreement in place, and they were fined by OCR for, like, I think it was $750,000 because it was considered major breach. There was no BA agreement in place. So it's critical to have the appropriate business associate agreements in place.
Those are some good clarifications, Ron and Leslie, and some great questions. Any other questions, David, that we're getting?
I think a couple comments from Scott, who sent these in. Too many incongruent P&P requirements is the concern he has. He says shred company, etc. And I guess he agreed with what you were saying. And next question is, how is OCR actually finding out who is or is not a CE/BAA to select from for their random audits? Are they just asking around the industry? As far as I know, there is no requirement to register with OCR as a CE or BAA.
Leslie, you might have a thought there, and then I might add to it.
Well, just a couple of things. First of all, I don't know that anybody knows completely how they're doing this. There is a lot of information on the website. We do know a few things. We know that they did use some random searching to make decisions. We do suspect that if you're publishing or you're contributing for breach purposes, that you might be considered. We do know because of high tech that there's reciprocity across the various governing bodies. For example, if OCR did come in to see you and they saw something that might trigger OIG, that they can refer, so that other might happen. And then the last piece that I was thinking was that we also know that with the initial round of these more recent ones of covered entities, they're requiring for the list of downstream business associates. So we know there's a direct relation there, and we're expecting that they will choose from some of those downstream BAs as well. Lee, is that what you were going to go to?
Well, I think in addition to that, Leslie, what I can tell you is that we do know they've hired contractors, and they've got other consultants that they've contracted to perform some of these desk audits working with their team. And so they've got access to a lot of information on companies, and they're doing, as you indicated, additional research trying to categorize companies the best they possibly can. So all I would say is, in answer to the question, in addition to what you were indicating, Leslie, is that they've got a lot of resources to be able to at least make a pretty good guess at organizations as to whether or not they're operating as a CE or as a BA. Especially, I mean, obviously, things like health plans, et cetera, and many other organizations. But there are obviously gray areas in relation to companies in which they could be operating as both a CE or a BA. So, but they've got a lot of resources, and they're doing a lot of research to try to vet these as much as possible before they're sending out notices. So, good question. Very good questions. Please keep the questions coming. Right. David, I'll let you interrupt me if you've got any. Do you have any others right now?
I got one now.
Okay.
Our organization handles PHI on a daily basis. Should we have a business associate agreement in place with a landlord on a leased space? That's from Rick Felice, Post and Track.
So I'll, if you don't mind, I'll go first on this one, then certainly have you guys chime in as well. So the Office for Civil Rights and the regulations, when they were initially promulgated, there were a lot of questions like this. Of course, there are frequently asked questions that have come in over the years now, and it has been clarified for us that a landlord, just like a cleaning company, does not need to be under, if they're not handling PHI, they're doing it as a job for you, but they may come across it, you should have some sort of control or protection in place. So just like a cleaning company or for a landlord, I know one of the standard things that I'll always ask for is at least a confidentiality clause in whatever your contract is. Then, of course, we would expect that just like anything else with security, your strongest ability is to have many layers. So you might have a landlord, but if you have protected health information that is left out overnight, when a landlord could come in and see it, what are the things you can do to prevent that from occurring? If it's paper, you can lock it away. If it's electronic, you can use your technical controls to assure they can't see anything. So in other words, it's a combination, but again, not necessarily a required BA. When we speak with lawyers and other compliance people on this topic, it's not necessarily recommended that you go and get a BA just because it might happen. You should be careful to say, I'm giving this person PHI to do something on my behalf, therefore they're a business associate. And you should keep that separate from those who don't have that job responsibility. But you should also keep your confidentiality clauses and anything else from a liability perspective. Ron, Lee?
I really don't have anything to add to that other than what you said, and that is you look at what the definition of a business associate is, and that's someone you're specifically sharing PHI with to perform a particular function, or basically there's an intentional purpose in having the vendor work with the PHI. This type, a landlord, a cleaning company, their purpose is not to do that, and I think Leslie covered it extremely well. You've got to have appropriate controls in place and agreements in place to make sure they don't come in contact with that.
So I think both of you did a good job in addressing the question, and thank you, Rick, for the question. I would also add that I work with a couple of practices, medical practices, and obviously they have cleaning companies that are coming in. And in many cases, they've got a lot of records, paper records, that are still in files that are out in the open in relation to their back office, in which cleaning companies have access. So I would tell you that in both of those cases, those organizations and a number of others, medical practice that I'm seeing, because of all the paper records, are putting BAs in place with their cleaning companies because of the potential access to any of the paper files. But I think, as Leslie stated, it's having, you have to really assess the risk, I think, based upon your organization and what you as an organization need to have in place. Again, comparing it against what OCR has provided as far as guidance. So I think what Ron and Leslie have gone over are prudent. Good. Any other questions, David?
Yep. Questions
Okay.
keep. Thank you. We are EMR software vendor. We host the customer's application in our cloud. We set up a lab interface in our software. We do not have any direct agreement with the labs. The relationship is between the provider and the lab. As a vendor BA, do I need BAA with the lab?
Ron, Leslie, I have my thoughts on it, but I'll turn to Ron. Ron, what are your thoughts on this?
I was trying to reread it again. Just if you want to go ahead, let me just study this a little more. Or I'll speak to it. Okay, we host the customer's application in our cloud, set up lab interface in our software. We do not have any direct agreement with the labs. The relationship between provider and the lab. As a vendor BA, do I need a BAA with the lab? I would think that since you are hosting a customer's application, that yes, you should have a BAA in place, because as a vendor that's a software vendor, unless you are purely providing software where you would never provide support, where you'd need to potentially come in contact with the PH. I would think most software vendors from time to time in supporting their product, especially in EMR, to work through technical details, there are times you come in contact with the PHI, and therefore I would say my very first out the gate thing would be to expect that you would have a BAA in place. Leslie, your thoughts?
Well, I just wanted to add, I think that these are excellent questions, and you're starting to see the exact kinds of things you're going to ask if you need to go and look at those uses and disclosures and the individual rights. And some of these, while certainly we always look for some sort of protection, and you look for that in a documented form, and OCR's language is the best that we can get with respect to if you're not sure what to use. So that makes a lot of sense. I also, though, think in some points here that it's a matter of sitting down and documenting the flow of the information, documenting what controls and what contract information is already in place among the parties, and then of course getting compliance and legal counsel, which I mentioned a number of times through the review. We try really hard not to try to give you that kind of consulting advice, but instead to say, have you done your due diligence to make these business decisions? So I'm kind of pushing it back as well.
Yeah, that's excellent. And let me also say something I missed here is there's no direct relationship between the lab and the software vendor. So yeah, it's who you have a direct relationship with, as Leslie was saying, and then making sure that, at least in terms of your BA agreements with them, that they require their other entities to have the appropriate BA agreements in place as well. And most importantly, what Leslie said, you've got to look to your own legal opinions on these and your own legal reviews of the relationships.
I was going to make that comment, Ron, so thanks very much for doing so. Great. Hopefully we addressed your question. David, any other questions?
One more coming. Do both the CE and BA share the responsibility for having a BAA in place, or does the responsibility fall to the CE covered entity alone?
Leslie, I think you can probably answer that well.
Well, I was just going to say to both of you, I would have answered that differently prior to high-tech. So as Ron said, prior to high-tech, it was very much expected that a covered entity should be trying to contract with their business associates, et cetera. However, high-tech very much kind of did away with all that and said, wait a minute, business associates, you're just as responsible. So, and I think that a lot of this also goes back to our businesses. You know, some of our larger businesses that have the resources and the legal support, et cetera, they may end up having to contract with the group health plans that are covered entities who maybe don't have that kind of support. But anyway, my comment was the answer would be you're both expected to know the rules, whether you're a covered entity or a business associate, and that's really very much, in my mind, what high-tech did, was to kind of clarify that for everybody.
And I'm totally in agreement with that comment, Leslie. That is exactly, I mean, the way it's interpreted today, it would be either entity would have the responsibility for initiating the BAA. Good. Other questions, David?
No, I think that is the last that I have.
Okay. Well, I've got a couple of questions here. And again, if you have other questions, please type them in, and we'll try to get to your questions. Ron, you know, one of the questions I was going to ask you is, how soon will accredited organizations be required to meet the changes that EHNAC is implementing related to this, that as one piece of this, and which of EHNAC's programs are going to include the updates related to the OCR Phase II?
Okay, from an EHNAC perspective, you're required to meet the requirements of the program that you receive when you apply for accreditation or for reaccreditation. So when you apply, you're sent a package, and that's the package that you're expected to meet. So if you, basically, if you were to apply for accreditation before the end of this year, depending on the timing of that, if you receive the 2016 revision of the criteria, it will obviously not have these additional requirements in it. If you apply after January or later in 2017, you'll receive the packages that do include these things. Now, one thing you can always do, if you receive an earlier package and then you see that there's a new version out there, you can request a later version. That is completely acceptable, and you just contact EHNAC operations and they can send you the newer revision of the package. Regarding which programs, it's every program. Every program, with the exception of CEAP, which really isn't an exception because you can't do CEAP by itself. You have to be doing one of our other programs, and then if you use a cloud service provider, you also have to do the CEAP package, which stands for Cloud Enabled Accreditation Program. So every program will include these changes effective January.
Great. Thank you, Ron. Hey, Leslie, you know, one of the other things, you did a great overview of really a lot of these provisions. You know, is there a specific drop-dead date that organizations need to look at to be prepared for in the event they are selected for an OCR audit?
Oh, that's a great question, Lee, and unfortunately the drop-dead date was probably yesterday. You know, if you haven't done this work, only you know your organization. And so if you feel like you stay up to pace with things and you're always doing your ongoing reviews and paying attention to what's happening across the industry, you can probably rest easier than someone who is admittedly just not getting the time to stay up with the current events. So I would say that you should probably, if you haven't already, looked at the OCR website. You should go do that immediately. And from there, that's going to be a great way to be able to discern just how much work you'll have to do.
Great. Thank you. David, any other questions?
Yeah, Lee, I've got one more question. It says, and this kind of goes back to our talk about the BAs a few minutes ago. How about the compliance with offshore BAs in terms of sharing the responsibility?
Leslie, I'm going to turn to you for that one.
Oh man, this one gets really dicey. So the first thing to say is think about the protected health information that you handle, and if it is at all related to our Medicare or Medicaid government programs, you need to have basically special permission to be able to allow it to be handled offshore. So you have to just immediately go back to, do you know what PHI you're handling and how you're handling it? The next is that, you know, HIPAA obviously is a national regulation. So as you start looking internationally, there's a whole other layer of various types of laws and rules that come into play. And if you're really going to seriously do something outside of this country, you definitely want to talk to legal experts in those areas. That would be what I would suggest.
Great. Ron, anything else you would add?
I think that covers it very well. I didn't catch all of that. One thing I'll highlight that's not directly related, but if you're an EHNAC organization and you have an offshore business associate, depending on the scope of what they do, we sometimes permit, if it's very limited scope like frontline customer support with very limited access to EHI, we will accommodate that in EHNAC, and basically that will be mentioned at our website with your accreditation that some sites couldn't be reviewed. But if you have production operations or key operations occurring overseas, then those sites would come into scope and need to be visited.
Terrific. Great. David, any other questions?
Yeah, I've got one last question. I think we only have 1 minute left. So
yep.
All providers, regardless of size, should they need some sort of audit?
Was that, should they need some sort of audit?
That's what it says. All providers, regardless of size, should they need some sort of audit?
If the question has to do with the size of the provider entity, if you are considered under HIPAA to be a covered entity, you are in. In other words, you're potentially, and of course if you're a business associate, not even a covered entity, I would suggest that this person asking the question go to the OCR website and key in for the covered entity determination tool, and that'll step them through. There are very few times that you're not considered subject to the rule, and that might help them.
Right. I think that's good. I think in most cases, I think just about any provider, regardless of size, could be selected based upon what we've been hearing. But I think Leslie's guidance is very good there. Let me take 1 second to, first of all, say thank you to all of you for joining the webinar. I want to thank Ron and Leslie for excellent overview. David, thanks very much for facilitating. And I also want to make the offer to all of you, if you want to get involved with our criteria committee, please do. We'd love to have you join the criteria committee and have an opportunity to see, as Ron was talking about, the criteria that's being developed and to influence the process. Lastly, I didn't see on our last slide here, David, the information to get a copy of the presentation. But what we'll do is we will send out an email to all of you to let you know how to get a copy of the presentation. We will include as well the additional information that I provided, which came from the Office for Civil Rights on their 2012 audits. So with that, I want to thank all of you again, and we look forward to talking with you soon, and we appreciate your going through and being EHNAC accredited. Take care, everybody.
Thank you.
Thank you.